Workplace injuries happen. Most happen fast. How you respond and how soon after the incident can determine a victim's chances for recovery or even save their life. Responding to an accident might evoke your fight or flight response. First aid requires a much different mindset. Being informed and practicing first aid ahead of an event is the only way to truly be prepared to help a victim. Are you ready to administer first aid? Can you quickly locate a first aid kit and related equipment at your workplace or job site? Do you know the steps to administering first aid for burns, cuts, choking, and other emergencies? While it's true that some first aid is basic and won't require additional medical assistance, you must also be prepared to provide potentially life-saving first aid to give victims their best chance at survival while waiting for emergency medical help to arrive. Keep in mind as we go through this training, first aid is no replacement for safety protocol. The proper sequence of protection in the workplace is first to purposely follow safe practices. Then rely on any personal protective equipment you may be wearing as a second line of defense. And finally, be ready to administer first aid and call emergency personnel when needed. Ideally, not only would every employee be prepared to administer first aid, but each workplace would also have a designated first aid provider. In fact, OSHA requires trained first aid providers to be on site, regardless of how large or small the organization, if there are no nearby suitable medical facilities available to treat employees who could become injured. Once you have determined first aid is required, and you have quickly but thoroughly assessed the situation, alerting emergency personnel if necessary, you can begin administering care if it is safe to do so. Keep in mind that whenever possible, even if you are waiting for emergency medical professionals to arrive, you should not leave the victim and should continuously monitor them. This is especially important for victims who are or may become unconscious. If you do determine that you cannot administer any additional care, providing them appropriate shelter, comfort, and helping them stay calm or conscious will still be beneficial and potentially life-saving actions. When major injuries or illness demand calling 911, always let the victim know that help is on the way. This can be done prior to receiving their consent to first aid and reinforced as appropriate. We will now deep dive into treatment methods for the minor and major injuries and illnesses, and also related physical states that are part of this training. It is assumed for each of these treatments that the first aid provider will wash their hands, wear gloves, and take other precautions to protect both themselves and the victim from the spread of infectious disease. As a general rule, always consider whether the treatment you are going to administer will improve the victim's condition or worsen it. Do not continue with care that will cause greater harm or bring them closer to death. In all of these scenarios, do not move the victim unless it is necessary for their continued safety. If there are multiple victims on the scene, prioritize care based on severity and likelihood of death. The primary goal of first aid is to save lives, and there is no perfect formula for making judgment calls in severe emergencies. Generally speaking, you will prioritize non-breathing victims first, followed by unconsciousness, head injuries, bleeding, broken bones, and burns. Each scenario differs in severity, and the best preparation is continuous practice and training. Cuts and lacerations are extremely common workplace injuries. Impalements are also common and can range from simple splinters to being stabbed by projecting objects. The first goal is to stop the bleeding. For minor cuts and scrapes, bleeding often stops on its own. When bleeding does not stop quickly, applying gentle pressure with a clean bandage and elevating the wounded area will slow down or stop the flow. Once bleeding has stopped, rinse the wound with clean water. It is best to avoid applying cleansers to the inside of a wound. Once cleansed, pat the area dry and cover appropriately. You can add a healing and antibacterial ointment as well. With amputations and other serious lacerations, first aid is again being administered while awaiting the arrival of emergency medical personnel. Attempt to stop the bleeding through the use of tourniquets and bandages. Do not place amputated body parts directly on ice, but do keep them in cold environments. Wrap them carefully to avoid direct contact with ice. If a wound is deep or has gaping or jagged edges, stitches would be needed, which is well beyond the scope of first aid. This is also true of any injury where bleeding will not stop or is gushing out. For all serious injuries such as impalements and amputations, be on the lookout for the victim going into shock or cardiac arrest. Another common and typically less serious scenario is a nosebleed. Someone experiencing a nosebleed should sit down and remain still. Pinch the lower portion of their nose gently but firmly. This is the part of the nose that does not feel bony. The victim may be able to do this on their own. Keep this pressure going for at least 15 minutes. If they are lightheaded, help them stay steady or sit upright to avoid further injury. In some cases, nosebleeds can be a sign of a more serious condition, so ongoing monitoring of the victim's status should be completed to determine if additional medical help is required. For minor burns or abrasions, run cool water over the affected area for several minutes. Cold compresses may also be applied. However, applying ice directly to skin could cause more harm to the affected area. If pain relievers are available, administer these as directed on the package. Some antibiotic ointments also have pain-relieving properties. Antibiotic cream or burn treatment gel or spray should be applied gently, followed by clean gauze. Do not wrap the gauze too tightly. If blisters have formed, they should be kept intact unless they are extremely painful. If a blister bursts, treat it as you would any other open wound. Do not remove the parts of the blister. Clean it, apply antibiotic cream, and cover appropriately. Very painful blisters can be drained, but the blister should first be swabbed with iodine. Then, using a sharp needle that has been cleaned in rubbing alcohol, the blister can be pierced near the edge. Use caution not to induce bleeding from pinpricks. Appropriate barrier ointments, bandages, and protective gauze may then be applied. A common mistake when treating burns, cuts, and abrasions is rubbing. Never rub the affected area. Call 911 for serious burns that cannot be treated simply through first aid. This would generally involve large areas, but always when there is charred flesh. While waiting for help to arrive, apply a cool, moist bandage to the affected area. Never immerse a body part in cold water, as this could induce shock. Although distressing, non-emergency musculoskeletal injuries occur often. These include simple strains and sprains, like a twisted ankle or a pulled back. In these cases, have the victim rest and relax that area. Assess whether first aid is appropriate and recommend a visit to their physician for follow-up if needed. Ice packs, heat packs, and support braces are often helpful. For minor musculoskeletal injuries such as these, follow the RICE acronym: rest, ice, compression, and elevation. More serious injuries include fractures and breaks. Bruising or even disorientation may also be signs of internal bleeding and contusions. Mental or other behavioral changes, particularly ones that seem beyond the victim's control, can be indications of shock, head injury, or spinal injury. Broken bones, severe pain, numbness, and the inability to use a limb correctly are other examples of serious problems. These are beyond basic first aid treatment, but administer what help you can. Never try to set a fractured or broken bone. Have the victim stay still to avoid further injury and provide for their comfort and safety while waiting for help to arrive. Eyes require particularly delicate treatment. Absolutely never rub an eye injury. Imagine if a speck of metal or other abrasive or sharp object were causing the injury or irritation. For minor conditions, blinking and the use of eye drops will help the victim's eye naturally remove the irritant. It is best to simply flush the eye whenever possible. Never remove objects that embed in eyes. Instead, use an eye shield wrapped with a bandage from your first aid kit and seek medical attention. For chemicals in the eyes, keep the victim's eyes open and call for professional help while locating the water source to begin continuous eye flushing. Mouth injuries may involve broken teeth or jawbone, along with bitten cheeks, tongue, or lips. This can cause significant bleeding and swelling. That, along with a threat of loose teeth and tissue clogging airways, can lead to difficulty breathing and a choking event. The first step is to check breathing and clear any blockages. Then bleeding should be controlled. This is best done while the patient is in a sitting or half-sitting position and by applying pressure to the tooth socket or wound. The same precautions should be taken as with other wounds, with consideration for ongoing monitoring and care to avoid swallowing foreign objects, checking for allergic reactions, and mutual protection against infection. Eye and mouth injuries, beyond the simplest of irritation and trauma, will require follow-up consultation of a medical professional. Bites from small animals and stings from insects might not seem like cause for concern. However, animals and insects carry disease, such as rabies and other illnesses. Moreover, many people suffer from allergic reactions to stings. For non-allergic reactions, treat a bite wound as you would a laceration. Wash the area with soap and water, followed by antibiotic ointments and a proper bandage sequence. In all bite cases, it is prudent to follow up with a physician to review the proper treatment for potential infection transmission from both animals and humans. Closely related to allergic reactions are respiratory issues. Anaphylaxis can occur as an allergic reaction that drives the body into shock, often causing airways to close up and restrict or completely cut off breathing. A victim experiencing an allergic reaction should be kept calm and asked if they have an allergy emergency pen. If you do not know how to administer an allergy emergency pen, you can often obtain practice pens and instructions from a pharmacist. Choking is another very common occurrence where prompt action can dramatically change the outcome for a victim. The classic Heimlich maneuver involves standing behind the victim. Lean them forward slightly with your arms around their waist and fist clenched. Grab your fist with your opposite hand and place these between their navel and rib cage. The maneuver is completed by pulling your clenched fist sharply back and up under the rib cage in several quick thrusts. For very large individuals or someone who is pregnant, this maneuver should instead be completed around the chest and not the stomach. Back blows are another common method of dislodging objects from the air passage. This is particularly useful for victims who have become unconscious and can only be set on their knees. During these attempts, if possible, look at a bystander directly and firmly order them to call 911. If you are unable to dislodge the object after initial attempts and emergency help has not been called, take the time to make the call. Have a sense for how long it has been since the choking began. If you yourself are choking and no one is able to assist you, leaning up against the edge of a table, chair, workbench, truck bed, or similar surface and thrusting against it may be your best chance at dislodging the object on your own. Heart attacks or other cardiac events are also common. Chest pain is a typical warning sign of a cardiac event, along with pain in other parts of the upper body, shortness of breath, nausea, cold sweats, and lightheadedness. Signs of a heart attack may vary based on gender or other physical characteristics. At times, cardiac events can be mistaken for heartburn, indigestion, or even soreness of the neck, jaw, or arms. If you witness a cardiac event underway and can communicate with the victim, ask if they have medications they take for their heart, such as nitroglycerin. If so, help them take the proper dose. Cardiac arrest and other heart-related traumas are common side effects of electrocution. Breathing may also stop due to muscle spasms or paralysis. Electrical burns are also extremely common. It is important to remember that electrical hazards must first be disconnected before engaging a victim, in order to avoid becoming a victim yourself. Cardiopulmonary resuscitation, known as CPR, should be started if a heart attack victim has lost consciousness. CPR and rescue breathing are not within the scope of this training. However, if you work in an environment with heightened risk factors related to cardiac events, it is recommended you seek out specific training on administering CPR and also AED device use. When an injury or illness, such as those experienced during prolonged heat stress, is extensive enough, a victim may go into shock or suffer a stroke. Sometimes, emotional extremes may also cause a person to go into shock. Shock and strokes of all types are life-threatening, so any care you provide will be done after calling 911 and awaiting the arrival of medical personnel. Signs of shock include cold, clammy skin, paleness, nausea, sometimes accompanied by vomiting, shallow breathing, chills, and confusion. Elevating the victim's legs, providing them with hydrating fluids if their injury safely permits it, and covering them to keep them warm are appropriate interventions. The treatment for hypothermia also includes covering the victim after gentle removal of any wet clothing. It might be readily apparent based on the situation that a victim is likely suffering from hypothermia, but common symptoms include trouble speaking, confusion, and poor coordination. They should be elevated off of cold surfaces and out of cold environments if possible, but all movements should be controlled to avoid sending them into cardiac arrest. Warm, hydrating fluids can be provided to conscious victims, along with the application of warm, dry compresses to only the neck, chest, or groin areas. Direct heat should be avoided to prevent damage to the skin or sending them into shock. On the opposite temperature extreme is a heat stroke. Heat stroke is the most dangerous heat-related illness. A person experiencing heat stroke will exhibit signs of confusion or disorientation. As with a typical stroke, slurred speech and seizures are common symptoms. Since the body has reached a point where it can no longer self-regulate, body temperature rises dramatically. The skin often becomes hot and dry, and the victim may even lose consciousness. Covering a person experiencing heat stroke is not advised. Instead, they should be carefully moved to a cool area and provided with hydrating fluids if they are conscious. Unconsciousness can be caused by any combination of injuries, exposures, emotional responses, allergic reactions, or other physiological conditions. By now, you as the first aid provider have called 911 and have determined whether CPR is required. Assuming the victim is breathing and their heart is beating and CPR is not administered, and depending on their physical state from any injury that may have occurred, they can be placed in what is called the recovery position until professional help arrives. Stay with the victim and continue to monitor them. If they regain consciousness, comfort them and reassure them that help is on the way. Fear of personal infection and injury may cause a person to hesitate when administering first aid. There definitely are risks involved. Victims may be disoriented enough to grow violent, or their unconscious reflexes may cause an injury to the first aid provider. Bloodborne pathogens, along with the risks from air and saliva exchange, should be mitigated as best as possible using appropriate barriers. There are also the risks run through exposure to what originally caused the illness or injury, such as chemicals, temperature extremes, electrical hazards, and so forth. Continued training and practice, coupled with the proper use of PPE during an emergency response event, will help minimize personal risk during first aid procedures. No single training can prepare you for every situation or all categories where first aid might prove of benefit. Remember that the goals of first aid are to preserve life, prevent further injury or worsened illness, alleviate suffering, and to promote recovery. Preparation starts with familiarity with first aid supplies and equipment locations, along with proper application and response. When in doubt, call 911. Emergency response personnel will talk you through proper procedures or will direct you to the correct agency. Time is always of the essence. Your intervention may make all the difference.